Hi everyone, my name is Andrea Constantine, and I am going to talk about family planning coverage in the workplace in the state of Texas. This presentation was originally put together by my Capstone 2 group, which included Kelly Hearn, Muhammad Islam, Ross Galetto, and Shantia Jones. I want to ask you to do something. Close your eyes and take a deep breath. Imagine you work in an office. Think of a time when your job affected your health. Perhaps you had a headache from the stress of an upcoming deadline. Or maybe you have carpal tunnel syndrome from typing out too many reports. Or maybe your eyesight is going bad from staring at a computer screen all day. Or maybe your voice is hoarse from practicing your presentation too many times. Take another deep breath and imagine you are a person of childbearing years. You just found out your employer had opted out of covering family planning for you and your family. Now open your eyes. We are going to talk about Texas and the state of their family planning. We will discuss how the Affordable Care Act impacts family planning, the Texas healthcare system, and how we can help the situation. The United Nations considers family planning a right. That is how important it is. A choice of the many contraceptives encourages consistent use, which in turn boosts the effectiveness. Planning is providing education about all contraceptive options. There is an abundance of positives with contraceptive use, such as avoiding preventable and detrimental issues during pregnancy, infant mortality caused by closely spaced pregnancies, sexually transmitted disease prevention, and controlling population growth. Let's talk about the Affordable Care Act. The Affordable Care Act, also known as the ACA, was signed into law by President Obama in 2010. This provided preventative and wellness care and effectively required employers to provide family planning services. At the time of signing, religious organizations such as churches and other places of worship were exempted from providing these services. When the Affordable Care Act went into effect, most women had no out-of-pocket health care expenses, which resulted in an estimated $1.4 billion in savings for women. In 2012, 43 organizations, which included churches, schools, hospitals, and other entities claiming religious affiliation, filed lawsuits against the government. These lawsuits were filed on the basis that the requirement to provide contraception at no extra cost violated the organization's religious rights. About a quarter of these organizations were located in Texas. In 2014, the United States Supreme Court ruled that organizations could opt out on religious grounds. Around the same time as these lawsuits, Texas opted out of the Medicaid expansion, which amounted to a loss of about $35 million federal dollars. This Medicaid program was intended to be used for low-income individuals. When Texas opted out, they had a marked decrease of healthcare services by 39%. And contraceptives received went down 41%. Right now, Texas ranks last in amount of adults who have health insurance, and 49th for children who have it. Texas, after California, had the most Medicaid births in the nation. A high number of these births were to teenagers and undocumented individuals. Since Texas opted out of the federal funds, clinics who relied on these funds had to pass the cost on to their patients. The year Texas opted out, they created their own program called the Women's Health Program. In 2016, they revamped and renamed it to Healthy Texas Women Program. This is completely state-funded and provides help to low-income women. Because this is state-funded and not federally, Texas can pick and choose what providers they fund. Providers such as Planned Parenthood are excluded. Planned Parenthood has been excluded due to a disagreement about the organization's involvement in abortion services. Right now, the providers that are included in the new program, only about half of them actually provides these services to women living in Texas. The clinic exclusions, coupled with the state opting out of Medicaid, had a few repercussions in the first few years. As stated before, healthcare services decreased and fewer contraceptives were received. In 2017, new nationwide regulations were put into effect. Nonprofits and for-profits with moral objections were now exempt from providing contraceptives. This makes up about 30 to 40% of out-of-pocket healthcare cost. When the ACA went into effect, most women had no out-of-pocket expenses. Women had a choice. Most were choosing long-term contraceptives, which had a higher rate of effectiveness. With these new regulations, most businesses in Texas could opt out of providing family planning coverage. Texas is known as the contraceptive desert due to how hard it is to get contraceptives. Many women have turned to other methods to obtain it. One of these methods is an app called Nurx. Basically, you go on the app, fill out some information, a doctor reviews it, and then they send you birth control pills free of charge. Texas women use this app at a higher rate than the rest of the nation because it is quick, easy, and affordable. This is not sustainable. This is not a sustainable long-term solution. If Texas continues to opt out of federal funds, it is recommended that they expand the number of mobile health clinics that provide full-range family planning services at no or reduced cost to the public. This will help in rural communities that have no space for a clinic. They do this in California. They provide free services such as pregnancy tests, STD testing and treatment, and ultrasounds. Texas has 254 counties. 177 of those are considered medically underserved. This accounts for 75% of the state. This map shows that about 1/3 of the counties don't even have one clinic. The mobile clinics should be targeted in these counties first. Women who live in rural areas and low-income women would benefit since many have to drive up to 300 miles since the other clinics have closed. A mobile clinic could bring the clinic closer to these women. If business owners morally object to contraceptives or can't afford to provide them, these mobile clinics can help their employees. 1/3 of the state would benefit from these mobile clinics. This could reduce the cost of healthcare spending by 24%. Medicaid and federal grants could pay for about 25%, even if the state had opted out. The Public Health Services Act in Texas, under Section 330, allows for purchasing land for clinics. This money could be rerouted towards mobile clinics. Other funds could be paid by the patient. They can have a small fee associated with their visit based on a sliding scale. So basically, healthcare in Texas, coupled with the religious exemptions and clinic closures in areas that need it, have made a high demand for health clinic expansions. Thank you for your time. I want to ask you, do you think employers should be able to opt out on the grounds of religious objections, even if their employee is not of the same religion? What are some of the options you can think of to provide family planning services to Texas?